With the holidays coming up, my patients often ask me if it's okay to travel while doing fertility treatments. It may be possible to travel while doing treatments, but there's some things to keep in mind. I'm Dr. Sharon Moayeri, owner and founder of OC Fertility. So timing is really important when you're considering travel. If you're prepping for your egg retrieval, you want to make sure that roughly 2 weeks doing your injections that you're local and that you aren't traveling during that time. But before the egg retrieval and then after the egg retrieval, that's a good time to consider travel. Make sure you let your team know what dates you plan to travel so we can make sure to work around those dates. If you're doing a frozen embryo transfer, then during the prep for the embryo transfer, we see you about once a week. And so oftentimes you can travel between those appointments as long as you're able to take your medications with you and keep them at stable room temperature. We don't want them to get too cold or too hot. So make sure that wherever you're going, if you're going to need to refrigerate any of those medications, you have a refrigerator handy. And if you're going to be on a plane, that you're able to take a carry-on with an ice pack so that you can keep those medications cool on the plane. So when you're prepping for your embryo transfer, we don't see you quite as often as we do for the egg retrieval, and it's a more protracted cycle. So we might see you once a week over the course of anywhere from 3 to 6 weeks, depending on your protocol. Between those appointments, you can travel depending on where you're going, as long as you can make it back to those appointments. And then once the embryo transfer occurs, which is the procedure where we put the embryo back in the uterus, I generally recommend that you stay put until your pregnancy test. And then after your pregnancy test, my recommendation is that you stay local for most of that first trimester. The main thing is when you are considering travel during your fertility treatment, just let our team know which dates you're thinking about traveling so that we can incorporate that into your protocol. The other thing to consider when you're traveling is how to manage your medications. If you're going to be taking medications while you're traveling, you want to make sure that they're adequately stored. So if you need to refrigerate them, you want to make sure that wherever you're going has proper refrigeration. While you're traveling, you want to make sure that you take them on carry-on. Do not check them in. I've had patients lose their medication on check-in bags. So do a carry-on and then make sure that you have ice packs in the carry-on if they need to be refrigerated. It's also important to ask for a doctor's note because if you're carrying any medications, especially if there's any needles, you don't want to get stopped in your checkpoint and have them confiscated. Another good idea is to have extra medication just in case you lose anything. Have extra injections, extra alcohol wipes. Maybe keep them in 2 different locations in case something gets lost. That way you always have a backup supply. So maybe keep some in your carry-on bag, and if you have someone traveling with you, keep a little extra in their bag as well. That way you also have backup in case something goes wrong, because it's very difficult to get you medications if you're in a different state, and certainly if you're in a different country. Sometimes the time zone can make a big difference in terms of your medication timing. So depending on what medications we're talking about, it may be important to consider the time zone, and that's something to talk to your doctor about as well. So the other thing I just want to touch on, we briefly mentioned keeping your medications at stable temperature. The other things to think about for storing your medications, so don't leave them anywhere that they can get overheated or too cold. This is particularly important for your injection medications. Those need to be stored at a very stable temperature, ideally room temperature or refrigerated temperature. A good tip is to have a travel cooler with you or make sure that wherever you're staying has a refrigerator at the hotel. If you decide to have some of your monitoring done elsewhere while you're traveling, just be conscious of the fact that some clinics won't do outside monitoring. So wherever you're going, you might want to look around at the local clinics and ask them ahead of time if they're willing to take you on as a patient. This may or may not be part of their practice, and if they do take you on, there's going to be an additional fee, typically on top of what you're already paying for your cycle. Other thing you want to make sure is that they're able to get the results back to us within a timely fashion. Some practices aren't able to do that. We usually want to have results back within the same day and certainly within 24 hours so that we're able to make appropriate decisions for you. The other thing I want to talk about during travel is rest, stress, and lifestyle. When we think of travel, we think of it as a time for rest and restoration. When you're doing fertility treatment, sometimes it can add additional stress, so you want to consider that when you make your plans. Sometimes flights get canceled, especially more recently. You want to think about your luggage and carrying the luggage, which might be contrary to a recommendation by your physician. You also want to think about if there's difficulty getting the medications that you need. If you're pregnant and you end up having bleeding or complications while you're traveling, that can be an added stress that makes it more complicated during your pregnancy. So these are the things you want to think about while you're traveling and make sure that it's worth the time that you're doing fertility treatment to make those trips. Sometimes you make plans very close during your travel to certain appointments, and if those plans get canceled, then it can be very challenging. So just make sure you leave yourself enough leeway so that you have extra days if needed to return back for your specific procedures or appointments. So if you're thinking about traveling during your IVF treatment, just make sure you plan that according to your calendar. Talk to your team so they know which dates you may be out of town. We want to know which dates you're leaving and which days you're returning so we can work your appointments around those dates.